This has been pretty much pain-free. It's not a bad treatment at all. I've had shock previously on my knees when I had tendinitis, and that was a bit more aggressive in terms of the machine that was used. But there's no way that I would have managed to make a comeback to Commonwealth Games without it. My knees were such a mess, and that really helped get me through. It was after Commonwealth Games I gave them a chance to recover properly, but Shockwave got me there.
So I will start by using Focused Shockwaves direct to the attachment, and this is a very specific shockwave device. So I will focus the energy on a very small point. You can imagine it like a needle. It's a different kind of pain. So this is a little bit more throbbing pain.
Kind of pain.
It's a bit more dull compared to the radial shockwave.
Just
so let's have a look around.
So
I will start a bit not spot on, but then I will move, and you will tell me when I hit the good area.
Yeah.
There. All right.
I can bear it.
You can bear it. Right.
If it's going to help, I can bear it.
Right. And there's no such thing as the more pain the better.
Yeah.
You should actually be on a good level. You should be on a reasonable level.
I'm pleasantly surprised.
Yeah, good.
Last time I had shock, it was very painful.
Yeah, I know that's the repetition. And when it starts to go down, the pain, the most acute pain, let me know and I'll change the spots. This is still a 5?
Maybe a 6.
Maybe a 6, all right. So I will say something like 500 hits in 1 point, and if the pain goes away, I will switch point early. Still the same intensity?
Yeah, if anything, it feels like you're coming slightly this way.
Right, let's
that's
see
okay,
if I'll change a little bit. Okay, yeah. This is a new good spot. Right.
It's kind of an intense dull ache.
Yes.
But it's not a sharp
like a
pain or
toothache.
anything. Yeah. So is this a new device?
It's not the new device, but it's the more expensive, more advanced device, the Focused. Okay, this is also a good spot. I can tell on your face.
I don't have game face.
So now we're already at 1,000 hits.
Yeah, brilliant. Okay. Thank you so much. I really appreciate it.
We're going to change for the radial shockwaves to do for more of the soft tissues. I will continue the treatment now with the radial device, so radial pressure waves, by going directly on the target with an applicator that doesn't move. So this is a ceramic applicator. This is to further increase the healing capacity of the body, the blood flow, and so on. I will then continue to treat the muscle belly itself for trigger points and finish up with fascia treatment and fascia release. And we'll end it up with a sort of a massage vibrating device, which feels very nice. So this is
brilliant. I'm looking forward to that bit.
Yeah, I can imagine. Okay, so please put your arm like this. This probably sounds a bit more like you used to, right? I start a bit away from the target, and then you'll tell me when I hit the good spot.
Yes, coming up to it, yeah.
This is the good region, yeah. And with this device, I'm not standing in the same spot like I did with the other one, because I now want to create a more generalized increase of blood flow in the region. And a bit of pain reduction as well. So this, normally a bit faster, will reduce the pain. So you probably feel that when I hit the spot, it's quite acute, but then it goes down quite quickly as well. Yeah. Should be fine.
Oh, that's pretty nasty.
Still alright?
Yeah, I can bear it, yeah. Luxury of having all of the equipment in one place.
Okay, so that's another 1,000 hits with this one. Then I will continue with the muscle belly, and I think the tightest one which I can feel, would be your pronator.
It's crazily tight.
But also, well, the flexors are actually quite alright. It's the pronator. Yeah. Now I'll continue with the applicator, which is called the D20, which is moving a little bit more. So it's actually on a spring, so you can see that the tip is moving a little bit, which is more suitable for trigger points and muscles. So let's see what we can find. You'll let me know if I find something that is. This is right.
It's a much sharper pain.
Yeah.
It's much more. It feels much more aggressive.
Yeah.
But it's a different kind of pain. It's not as dull as when you started. It's.
My opinion about it is that this is easier to tolerate.
Yeah.
And the other pain, which is dull, is a little bit like creeps on you. You just want to get away. So is this feeling better now? Yeah. All right. Let's move on. This as well.
It starts as a sharp pain and then it just goes numb.
Yeah.
Not yet.
Not yet. Better, yeah.
Feels like it wants to be a bit further around.
Further down or that way?
That
Right,
just-
this way.
Yeah.
Yeah.
My face said it then.
Yeah. All right. That up. Okay. Now we'll do the final step of the treatment, where we'll try to treat the fascia as well, the superficial fascia in this region, because there's some obvious tightness just here, right? And I'll try to do that with the fascia applicator. Then I lower the hertz to 10 hertz, and I'll lower the energy as well, because we don't need a lot of energy. This is no longer shockwave, this is just an added tool to the shockwave device. So this is vibrations. We use the vibrations together with the friction in the skin to create a shear force between the different layers of the fascia. So this is what we're doing. And I prefer to do this in a semi-tensed way, so I tense the fascia a little bit. Maybe sometimes you need to keep your hand like this. Just let me see. Yeah, this would be better for your fascia actually. So, all right, let's start. It's a bit painful, it's a bit itchy in the skin, I would say, but you will see. This is how it feels. And you can actually feel with just where the friction is there. So this is in the region where the fascia is a bit tighter because the friction is higher. You can feel it with the tool. And normally 3 to 5 strokes like this will actually make a change in the fascia, so you don't have to continue for a long time.
No, it's not too bad. Oh, it's fantastic treatment. Tendinitis.
Alright, something like that. Now it's moving faster, it's easier to slide in the fascia. Let's see how it's over here. This is quite stiff as well. Does this feel alright? Yeah. What happens if we go over here? So this is really soft. This fascia, there's no resistance at all in this.
You can hear the difference.
Yeah. While here it's a little bit more resistance right here.
I'm gonna have a new arm after this.
Yeah.
Just tendinitis that you use this for?
Well, you use it for the totality. So the tendinitis would be sort of the specific pathology in the region, right? While quite good.
honestly,
The range of motion is good.
yesterday I could not go past that.
Yeah. You can see this is acceptable. This is good.
Yeah.
All right. So let me have a look at this as well. From here.
When we were doing, when my physio had it yesterday, she was looking at the fascia through here, but also up through here.
Yeah. But I can feel you already have a result from yesterday.
Yeah.
This was still tensed, but now it feels a little bit better. But your question, only tendinitis, or actually not tendinitis per definition, it should be tendinosis, which is the more degenerative state of the tendons. This is the classical indication, but this would be a specific pathology, so to speak. But then there is a reason to why you get this. Normally it is because of stiffness here, or stiffness there, or stiffness there, or maybe the neck as well. So you can treat all the different parts using different applicators. Yeah. The last part is the one you probably like the most, which is a massage tool, which is called the Peri-Actor, and this has nothing to do with shockwaves, it's only vibrations. And what we can tell about this is nice for you, of course, but it also affects the whole system because there's a very high frequency, like we're working at something like 25 Hertz plus. This speaks to the gate control system, which will give a pain reduction in the area as well. So it's a good way to end the treatment, to be friends again. This is just vibration therapy, it's just massage. At the end,
Shockwave is, we've gone through several steps.
Yeah. This will be the last step. And before a competition or something, just to activate the muscles, this is also a good tool to use actually. Instead of stretching or massaging, you can use this because the high frequency of the vibrations will facilitate the activity in the muscle.
Golfer's elbow tendinitis. Yeah, and I've had it for about 9 years now, and I just can't shift it. But with my sport, it was never really an issue because the gripping was never an issue. But I had shock treatment on my knees before, so I know how good it can be. So I just thought I'd come in and see.
Are you a golfer or was it another? Are you a golfer?
No, weightlifting. But we use foot grip, so the gripping was never an issue.
So let's feel how it feels.
Well, I have pronation and even better than the other arm.
Yeah, I can see that.
Yesterday I could go to about there.
Is that your first treatment?
Yeah. So I had a bit of fascia release yesterday, and this today. Yeah. So thank you so
All right,
much.
you're very welcome.